Hi, I'm Candace Morello, and I'm Professor of Clinical Pharmacy and Associate Dean for Student Affairs at Skaggs School of Pharmacy and Pharmaceutical Sciences at UC San Diego. Well, I'll tell you, I'm close to 25 years in my profession here, and there's been a significant change in the push for pharmacists to become more involved in collaborative practice in treating patients. And I think that's been the biggest push, is working at the top of our license and integrating into medical teams to just help improve care. So about 10 years ago, I was given the opportunity to work at the VA, and under the guidance of and overseen by an endocrinologist, create a clinic that is specifically to treat complex people with diabetes, type 2, and do it in a way that after 10 years or so of practice, I realized we need a better approach. So I created this tune-up clinic approach, this model. And so basically what we do, it's truly personalized care. And we help complex patients with type 2 diabetes achieve their goals, and we do so in a short amount of time. It's maybe an average of 3 visits over about 6 months, and they achieve their goals. It's amazing. The tune-up clinic comprises not just the drugs or that sort of thing, because diabetes isn't just that one thing. We teach them very specific things about how they can change their activity, what they're eating, the quality, the portions, that sort of thing of what they're eating. Our goal is to help give them tools so that they can control their diabetes and have just a healthier lifestyle. We wanted to know as well, how are we doing, So you gotta justify your services, right? So we started out looking, and we created this research team of students, because while I'm also a clinician, I'm a professor, and I wanna give students opportunities to learn how to create questions, design studies, and investigate. So we decided to look, how are we doing compared to a comparator group, the primary care providers or standard of care? And what we found is that we really had significant outcomes. Compared to primary care, which at 6 months had an A1C reduction of 0.8. A1C is what we measure glycemic control, or how well a patient's doing. And our patients had an A1C reduction in that 6-month period, being in our tune-up clinic, average of 3 times, of 2.4%. And that's really, about you, 0.8, 2.4, big deal, but it really is significant, because with every 1% A1C reduction, there have been multiple studies that demonstrate you can reduce the complications of diabetes. And we also figured out that it's cost effective, and we looked at it through very different models. Our return on investment it was $9.01 for every $1 spent. So it's beneficial not only to the patients who feel better, they're happier. My colleague, Dr. Hirsch, would say, well, maybe it's just you. Maybe it's not the model. And I said, okay, fine. The hardest patients to treat, if you look in the literature, are patients with mental health diseases. If they have mental health disorders, it's associated with poor adherence, poor glycemic control. I said, fine, let's look at those patients in our clinic and compare. So we did, and in fact, today we just got published our manuscript on these outcomes. And what we showed is it didn't matter. Using the DIM Clinic tune-up model, if patients had mental health disorders or if they didn't have a mental health disorder, they achieved the same A1C reduction of over 2%. Didn't matter. And in fact, the primary care providers love our clinic, because we tune up the patients. The patients are sleeping better, they feel better, they have more energy, and when they go see the primary care clinic, the primary care providers can focus on the other chronic diseases the patients have. So it's actually more effective for them as well.